My name is Michelle Giannotto. I'm the Vice President for the nonprofit Auto-Brewery Syndrome Information and Research. I'm also a volunteer patient advocate. We have about 800 members in our support group that we are trying to help with this medical condition. And I'd like to back up a little bit and give you some history on how I got involved in this medical condition. Back in 2013, I met my husband, Danny, and we dated for about a year and a half, and we got engaged. And one of the things he talked about is he wanted to fix his nose. He had broken his nose a few times. He had a deviated septum, and he decided he was going to go for surgery and get his nose fixed because he didn't want the wedding photos to look silly with his crooked nose. So in September of 2015, we went to see a surgeon, and they performed the surgery. And the risk with all surgeries is infection. And unfortunately, he got a post-op infection. He was in a lot of pain. And when the doctors did a CAT scan of his head, they found that he had a really bad sinus infection. And they admitted him to the hospital under observation for 24 hours with a IV antibiotic. And he left with a 14-day supply of an oral antibiotic. And he never really recovered. He wasn't the same man. There was so many changes in his demeanor, his behavior, and things just escalated. He was a type 2 diabetic, and his diabetes, his blood sugar became uncontrolled. Very high highs, very low lows, and before he never had a problem with his glucose levels. And he also had slurred speech, especially at night. He couldn't walk. He was constantly sleeping. He was having memory lapses. And I started becoming really concerned. So for a few months, I kept telling his doctors, he's just not recovering. There's something wrong. What happened during his surgery? And with our follow-up appointments, they said, you look terrible, but we don't find anything wrong with you. They ran blood work, and nothing came up out of the ordinary. About 3 months later, he was laying in bed. He was unable to get out of bed for days, and I was afraid to leave the house because he just wasn't right. It's not normal to sleep 3 straight days. And I was in another room, and I heard him coughing, and it wasn't the same cough. I ran in the bedroom, and I found that he was having a full-blown seizure, and he was choking on his own vomit. I ran to the bed. I turned him over, and I dialed 911, and the ambulances came, and they rushed him to the hospital. And I, at this point, had so much medical documentation, blood tests and CAT scans and EKGs from all the follow-up visits from the time he had his surgery up until that point. I just handed all the documentation to doctors, and I said, please find out what's wrong with him. This is not normal. He was in ICU for about a week. And regardless of what tests they ran, they couldn't figure out what was wrong with him. They did mention to me that he was in alcohol withdrawal. And I had asked the doctors, how can someone be in alcohol withdrawal if they don't drink? He was with me in bed 3 days. Didn't get out of bed. I had to walk him to the table to eat. There was no alcohol consumption. How can this be? And every doctor under the sun walked in, and from infectious disease to, there were just so many doctors, and no one could figure out what was wrong with him. Eventually, he was released from the hospital. But his illness continued for another 12 months. And he was hospitalized every 3 weeks for a week. Same things: seizures, uncontrolled blood sugar, slurring his speech, falling. And regardless how many times he was hospitalized, every blood test came back negative. They could not figure out what was wrong with him. But I started to notice a pattern. He looked as if he had been drinking. And this confused me because I was really watching him closely to try to figure out what was going on. Why was he displaying all these neurological symptoms, but he wasn't drinking? And I kept saying to his doctors, but he looks like he's drunk. And, his endocrinologist had said, well, he has diabetes and sometimes they display those kind of symptoms like they're drunk. And I don't know about that. I've made a few phone calls to people who are diabetics. And I said, does this happen to you? And they said, no, not at all. So I knew we were missing something, but I didn't quite know what.
For more information, case studies, and to make a donation, go to www.autobrewery.info.